We're gonna start with her spay today because that will require a bit more anesthetic, a deeper level of anesthesia, and that way once we get that portion done we can turn her level of anesthesia down while we're working on her teeth. Rabbit skin is very thin. They have 2 horns to the uterus and 2 cervices. Actually you can tie them off together. They look very much like a dog and a cat, but you can tell they're a little bit different. You can see the 2 cervix. And much like our cats and dogs, we spay these guys, 1 for population control, but 2 in rabbits. They have a fairly high incidence of uterine carcinomas as they get older. That's cancer. There's 2 reasons why we do it. 1 health and 1 for population control. Oh, I've done them as early as 4 months. These are her little teats. 2 little teats for nursing. She has another 2 that are hidden in the hair here, and there'll be another couple up here, and there's probably usually another 2 back here somewhere, but maybe not with her. Rabbits can have babies about every 30 days potentially, so they're very proliferative, and they can get pregnant while they're nursing. Some people think, well, they won't get pregnant if they've got a litter of little babies, but they can.
Stella has been moved from the non-sterile preparation area to the sterile operating room, where she will undergo an ovariohysterectomy, also known as a spay. She is breathing a mixture of anesthesia, isoflurane, and oxygen. PO2 refers to the amount of oxygen in the blood. If too much anesthesia is given, Stella could become starved for oxygen, resulting in brain damage or death. If too little anesthesia is used, Stella could retain awareness and memory of the surgery and the pain caused by the procedure. Therefore, it is vital that the mixture of isoflurane and oxygen is calibrated and monitored to assure that Stella receives enough anesthesia to keep her asleep, but not so much that she is deprived of oxygen.
This is just a little different machine that we're using to keep her anesthetized. Thankfully, most of our anesthetics now have very little residual effect. You could, before we had some of the newer gases, you could actually have the gas would actually accumulate in the fat of the body. So over time, with repetitive anesthetic procedures, especially if they were close together, you could get a cumulative effect where you'd have too much anesthetic in the body. Yeah, we're doing okay. She just seems like she's breathing a little harder than I'd like for her to be breathing. And I can't get a good PO2 reading on her, so that's not good. I'd like to at least get 1 good one. Measures her oxygenation of her blood, make sure she's getting enough oxygen. We like it to be above 93 or so. We're happy if it's 90 or above. And ideally, in best case scenario, you like to see it between about 97 and 100% oxygenated. That measures kind of a percentage of how much oxygen is in the blood. Got a nice flap of tissue there we can try there. She's breathing good. She's just breathing kind of deep. See, it says she's just 85, so I'd like to see her a little better than that. Yeah, that's what bothers me. Her breathing is more dramatic than I would expect it should be. So, well, sometimes you don't get a real accurate reading on the skin because of just how their coat is. So I'm just trying to see what it is on the tongue. If it really is 85, turn it off for me. Of course, her tongue is just going to slide back into her mouth so that I can't get a reading on it. You know, we're going to have to put the mask back on her. She's waking up. Can't get a reading on the ear. That's the problem. I've been trying to get a reading on the ear. That'd be the ideal place to get it. Her heart rate would suggest she's still a little bit light. She's not, doesn't have a lot of anesthetic because it's still running about 214. The EKG looks normal. Nothing abnormal about it. But I don't like her PO2. I can't get a good reading on her PO2 that makes me feel happy. I'm just trimming a little hair so that I can try to get a little reading off, maybe off her foot. In people, they get your PO2, they put a little thing on your finger. We don't have hair on our fingers, so they can tape this little thing around your finger and measure the same reading. I'm just trying to sort of create a finger, if you will, without the hair so that it can doesn't have to go through all the hair. Sometimes that will make the number look lower than it really is. And of course there'll be the vessels in her foot will be a little bit bigger than the vessels in her ear. Her breathing, I'm happier with her breathing. It's a little more shallow. It doesn't seem as labored to me. A little more regular. See, and I'm at 98, so that's normal. Seems like a lot of trouble to do all this, but we're trying to make sure we don't have a problem. It's looking better. We had 91, she's coming on up. I think she's breathing a little better. It's 96, so I'm happy.